Recording. Okay. Hello, everyone. Thank you for joining this week's seminar. And so today we'll be going over the case study of HeLa cells. Then we'll be talking about pancreatic surgery. And then we'll be talking about some interview tips. And as interviews are soon going to be coming up for those who are getting offers soon. And then we'll be talking about obesity. All right, we can start with the case study of Henrietta Lacks. And essentially, her cells were taken, and her cells created the immortal life. Her cells were immortal, the first immortal cell line. And that really has advanced medical knowledge and also a lot of things which we'll be discussing today. Okay, so a little bit of a personal background on who Henrietta Lacks was. She was born on the 1st of August, 1920 in Virginia, and then she died on October 4th, 1951, and she was aged 31, so quite young. And so for her profession, she was an African American tobacco farmer, and she was married to David Lacks in 1941. She was a mother of five children, and she lived in Turner Station, Maryland, near Baltimore. So, because she was born in Virginia, she was raised in Virginia, and so that was after her mother's death in 1924. Then she moved to Baltimore, seeking better opportunities. So in January 29th of 1951, she felt initial symptoms where she felt a knot in her womb, and she experienced abnormal vaginal bleeding, and she went to John Hopkins Hospital, which was one of the few hospitals that were treating Black patients back then. And so Dr. Howard Jones discovered a large malignant tumor on her cervix, and he diagnosed her with an unusually aggressive form of cervical cancer. And so this tumor's appearance was unlike anything the doctors have seen before. Um, and so it was quite unknown. And so the treatments she received were quite standard treatment back then for any type of cancer. So one of the treatments she received were radium tube inserts, which is also known as now brachytherapy. And this involves the use of radium tube inserts, which are made of platinum, and it has like radium inside, and it's designed so then it can deliver direct radiation to the tumor. And this was inserted through incisions. And so she underwent multiple radiation treatments to treat her cancer, and this treatment did initially work and caused the tumor to shrink. However, the disease progressed. Unfortunately, by August 1951, she was experiencing severe abdominal pain, and she required admission again. And the cancer unfortunately metastasized throughout her entire body, which means that it spread throughout her whole body. And unfortunately, just after 8 months of her diagnosis, she died on October 4th. So I've included a diagram which is showing you how the radium tube was inserted into her cervix. And this was standard treatment at the time for women that were dealing with any cervical cancer issues. Now, what happened? So during diagnosis and treatment, tissue samples were taken from her cervix, and there were two types of samples that were collected. One was healthy tissue, and one was cancerous tissue. And it's important to recognize that this tissue extraction was done without her knowledge or permission, and this was standard practice in the 1950s, and consent was not required back then, and it wasn't really prioritized for patients that much because doctors were just like, we're just there to treat you, and whatever, treatment you require, we will give it to you. There's not much consent like there's not much of a need for consent back then. And so these samples were given to Dr. Otto Gay, and he is a really important figure in this whole case study. And he was a physician and cancer researcher at Johns Hopkins Hospital, and he had been trying for years to grow human cell lines outside the body. But previous attempts with other patients had all failed because these cells obviously didn't survive and they just didn't just survive. And so after her death, so after Henrietta's death, Dr. Gay had lab assistant Mary Kubikek to take additional samples during autopsy. So she was dead by then, and he asked his lab assistant to take samples. So the family was never informed about this cell collection, nor was obviously Dr. Henrietta Lacks. And so there was no compensation offered to the family either. Now, there is historical context. At this time, this was legal and considered acceptable practice. It wasn't really thought of as important to really consider a patient consent, but obviously now it is one of the really important NHS guidelines and principles. There were no laws protecting patient consent for tissue samples, particularly for poor or minority patients like Henrietta. So the discovery of these immortal cells. So um, the biological reason to why Henrietta's cells were different and were immortal was that because most human cells died within days of being removed from the body, but HeLa cells, which is Henrietta Lacks cells, they survived and thrived even, and doubled every 20 to 24 hours, and this could be kept alive in culture indefinitely. So what made them why were they called immortal? They never stopped dividing and reproducing. And 70 years later, HeLa cells are still alive and reproducing in labs worldwide. And it's a little bit crazy for me to think that there are 55 million tons of HeLa cells that have been growing ever since her death. And that's like really, really like weird if you think about like 55 million tons of HeLa cells. And these original cells are continuing to be cultured today in various different institutes and research facilities. Um, so obviously the biological explanation to why these HeLa cells were immortal was the fact that Henrietta was infected with HPV-18, which is one of the most dangerous cancer-causing strains. And most cells have natural breaks that prevent uncontrolled division. And according to Hayflick's limit, which is essentially a phenomenon that describes that after a certain times of replication, normal cells enter a stage of non-replication, and that certain period and a certain like number of divisions is about 40 to 60 times before entering that non-replicative stage. So how HPV made the immortal cell line possible was that HPV-18 attacked the cellular sentinels that controlled the cell division, so the natural breaks, and this virus turned off the genes that normally suppress tumor formation. And because these breaks were obviously removed, cells could now divide forever. And so the HPV inserted its DNA into her cells and forced them to produce cancer promoting proteins. And that's how essentially cancer works. Um, Cancer obviously turns off the gene that controls the cell division properties of cells, and that's why they start dividing abnormally and forming tumors. And that's essentially what happened. So mass production and distribution. So Tuskegee's university's role was really important in this. So scientists at that Tuskegee's institute built the first cell factory, it was called. Um, and this was led by doctors Russell Brown and James Henderson. And by June 1955, so this is around 4 years after Henrietta's death, they have shipped approximately 600,000 cultures of HeLa cells. And so this developed revolutionary protocols such as rubber-lined like containers, temperature control, and quality control measures to actually preserve these, like cultures that have been produced. And so this has also really affected how scientists carry out these cultures, not just for HeLa cells, but also bacterial cultures. So it's just creating these cell line has really transformed how scientists and biologists work. And so then the HeLa cells were commercialized, and by 1954, these microbiological associates copied Tuskegee's methods, and they set up a large-scale factory in a former Fritos factory in Maryland. And this began the global distribution of HeLa cells, and this launched into a multi-billion-dollar biomedical industry. So the current availability right now is that companies such as Sigma Aldrich and ATCC sell HeLa cells commercially. And these are available to researchers worldwide. And so when I mentioned that there are many, research institutes that have access to HeLa cells, it's through these companies that they buy HeLa cells. And so they're simple to obtain and maintain, and they're a cost-effective research tool because they can be replicated again and again. 55 million tons of HeLa cells, which is absolutely crazy. Then there is obviously a global relevance of HeLa cells. Over 100,000 scientific publications have used HeLa cells. As of 2018, I couldn't really find any more up-to-date data when I was researching for this. And more than 11,000 patents. Oops, sorry. Over 11,000 patents involve HeLa cells. And so this was used in over 75,000 scientific studies globally. So you can imagine the scale of HeLa cells and how important they were for scientific advancements. Now, I'll be discussing some revolutionary medical breakthroughs that happened because of HeLa cells. So now the polio vaccine, this is obviously a very important example, which happened in the 1950s. So Jonas Salk, he needed cells to test the polio vaccine, and monkey cells were initially used, but they were expensive and they weren't really human cells, so you couldn't really tell if the polio vaccine would have worked on human cells. And these monkey cells also died during testing. So HeLa cells were perfect for, to test the polio vaccine because it was susceptible to the polio virus, but also nearly impossible to kill. So these mass-produced HeLa cells were made vaccine testing possible, and this polio vaccine then became available in 1955. And as a result, polio was eliminated in most countries, and 17 million paralytic cases have been prevented through the polio vaccine, which was created through the use of HeLa cells to test it. So you can see the large scale of medical breakthroughs that HeLa cells have, enhanced essentially. Then HPV and cervical cancer, there was research done on that. So Dr. Harold Zurhausen, which I've included a picture of, he discovered HeLa cells he discovered that HeLa cells contained the HPV-18 strain, and this proved that HPV causes cervical cancer, and this led to the development of HPV vaccines for people that had HPV or cervical cancer. And so obviously Henrietta Lacks died from HPV, but vaccines were developed because of her cells. And this reduced HPV infection in teenage girls by two-thirds. So two-thirds of teenage girls had a reduced chance of, developing HPV or getting HPV. And so he was awarded the 2008 Nobel Prize in Physiology and or Medicine. So then cancer research was also enabled through the use of HeLa cells. The drug camptothecin was tested on HeLa cells in the 1980s, and this slowed cancer growth. So now this is a very common drug that is given to cancer patients to slow down the progression of their disease. And gene mapping and understanding the cancer mechanisms were some features, some things that were enabled by HeLa cells, just the presence of HeLa cells. So HeLa cells, they were also used to test cancer treatments and chemotherapy drugs. Many more. Camptothecin is just an example that I used. And also understanding, then the HeLa cells were also used to understand how cancer spreads and metastasizes. And I've included the chemical structure of camptothecin here. Um, HeLa cells were also used in COVID-19 research. It helped understand how SARS-CoV-2, which is a strain of COVID-19, how it enters and exits cells. So because of HeLa cells, we were able to develop, rapid vaccines, and that also prevented many deaths of patients that got COVID-19 or might have gotten COVID-19. Then HIV and AIDS research was also enabled through HeLa cells because they were critical in understanding how HIV infection really works and the mechanisms behind it. It also contributed to a lot of Nobel Prize winning HIV research and also the development of many treatments and testing methods. So essentially, HeLa cells improved not just how scientific research was carried out, but also developments of multiple treatments for multiple different diseases and viruses. Then scientists also discovered chromosomes have caps. So this is talking about cell structure, which is known as telomeres. So through analyzing HeLa cells, they figured out that there are caps on chromosomes, and they found an enzyme that replenishes these caps, and this prevents essentially the cellular breakdown. And this helped understand the biology of aging and premature aging disease, and this led to the 2009 Nobel Prize Award as well. So obviously, the Human Genome Project was also, influenced through the presence of HeLa cells, and the use of HeLa cells contributed to understanding genetic diseases and advanced personalized medicine. HeLa cells were also sent to outer space in capsules in 1964. Scientists used HeLa cells to study effects of zero gravity and radiation on human cells. And this informed future manned space missions. And through this information that they gathered, they were able to develop new spacesuits and new technology that they could give to astronauts going up to space to prevent any cellular damage to their bodies. And so obviously HeLa cells were not just only used for scientific or medical advancements, but also space advancements, which is amazing. Other diseases that were studied through the use of HeLa cells were salmonella infection mechanisms, measles virus mutations, Zika virus research, leukemia and blood cancers, and sickle cell anemia. So a lot of diseases were studied and understood by HeLa cells. And there were three Nobel Prizes that were enabled through the use of HeLa cells. So in 2008, HPV and Cancer Connection, which was given to Dr. Harold Zurhosing. And then 2009, when the researchers found that there were caps called telomeres on chromosomes. Then in 2014, where super resolution microscopy was for live viewing of cellular processes was also invented. So I didn't touch on this, but using HeLa cells, scientists were able to essentially come up with many different microscopic techniques that help now to basically view live specimens of cells. So now the family, the effects of the HeLa cells on the family. So the Lax family remained unaware of this, the medical advancements that were caused by HeLa cells for over 20 years after Henrietta's death. So they struggled, financially. They couldn't even afford proper medical treatments, but HeLa cells were, enhancing many different cancer research and medical research as well. So in 1975, scientists contacted family members of Henrietta Lacks for genetic testing, and then the family learned that HeLa cells were being used and existed, and they were being used worldwide. And this was revealed in the 1976 Rolling Stone article by Michael Rogers. And when the family found out, obviously they were confused, they were angry, and they were just feeling betrayed essentially because they couldn't afford any medical treatment because they struggled financially. And through the genetic testing, the family's genetic information was also exposed to the media, and this obviously caused a lot of privacy violations. And so ethical violations that occurred through HeLa cells and how they were obtained. So obviously there was a lack of informed consent. The cells were taken without Henrietta's knowledge nor permission. And this was the standard practice in the 1950s, but it was ethically problematic for the family that were struggling. But there were, microbiological advancements that were happening that, obviously um, caused a lot of money to be made through this, but it wasn't really affecting the family in any other way. And then there were obviously privacy violations because in 2013, researchers published the complete HeLa genome online. And so obviously this genome gave information about not only Henrietta Lacks, but also her family and descendants. And genetic information about Henrietta and her descendants was obviously revealed without consent as well. Then, obviously, the commercialization without the compensation. So, multi-billion dollar industries were built on HeLa cells, but neither Henrietta nor her family received any financial benefit. Okay, now historical context of medical racism, because it wasn't just HeLa cells, it wasn't just Henrietta that was affected by medical racism. It could be, but Marion Sims, he's considered the father of gynecology. He performed experimental surgeries on enslaved Black women, and especially enslaved Black women, not just like any other woman. And these operations were done without anesthesia, so they would have hurt a lot. But other patients back then, they were still using some sort of anesthesia on them. But because they were enslaved Black women, these operations were done without anesthesia. Then he used their bodies to develop surgical techniques that obviously now benefit a lot of people around the world. But we can see how, a lot of scientific advancements were caused by medical racism. Then the Tuskegee's syphilis study between 1932 to 1972, so it lasted about 40 years. So the U.S. Public Health Service studied untreated syphilis in black men. So these participants were never told that they had syphilis, and they were held from treatment even after penicillin was available. So they infected these black men with syphilis and then didn't give them the proper treatment they need. And this continued for decades, and many participants even died. And it's estimated that about 128 people died from the syphilis study. Then Puerto Rico contraceptive trials, which happened between 1950s to the 1960s. And so oral contraceptive pills were tested on low-income Puerto Rican women. And they were not informed that this was like a clinical trial. They were kind of just forced to have it. And it deliberately used higher doses than necessary. And obviously, this affected these Puerto Rican women in many different ways. Maybe they wanted to have a family, but they couldn't because of these contraceptive pills. And they weren't informed about the causes of contraception, and maybe they didn't want it. Then there are obviously ongoing disparities even now. Despite the HPV vaccine developed using a black woman's cells, black women still have less access than other women to HPV vaccines. Black people are also represented in clinical trials and as medical professionals, and their poorer health outcomes. These poorer health outcomes are persistent, despite the research on minority bodies. Now, policy changes and justice efforts. So, the formation of HeLa cells, they did cause a lot of ethical debate, and through those debates, there were many rules and justice efforts that were, enabled. So, in 1991, the Common Rule was established. So, the U.S. government established some ethical guidelines for human research, and this required informed consent for tissue use, and patients must be, and basically what the common rule said was that patients must be fully informed about how tissues and data will be used. However, there were still gaps still exist in the current law. Then in 1964, there was a Declaration of Helsinki, and so the World Medical Association outlined ethical principles to ensure safety of research participants, and to protect identifiable information such as genetic information. And they also ensure that the participation that was it was always voluntary. Then advocacy and awareness. So, an author named Rebecca Skloot wrote a book on Henrietta Lacks named The Immortal Life of Henrietta Lacks. And this book brought the story to the public, and obviously, this sparked a lot of ethical debate about how Henrietta Lacks cells were used. Then in 2017, there was a HBO movie starring Oprah Winfrey. Then the Henrietta Lacks Foundation was also established to help those used in research without consent. So there are many different victims, but we tend to focus on Henrietta Lacks because of the scale of advancements her cells have caused. But yeah, the Henrietta Lacks Foundation does help other victims that were affected by research that was done without their consent. Now, 2021, the WHO, so World Health Organization Director General, awarded a posthumous award to Henrietta for her, just her cells and how those cells have enhanced the medical world, not just the medical world, but also the scientific world. So what can we learn from Lax? So her story transformed bioethics and research practices. It sparked crucial conversations about consent, privacy, and equity. And it reminded us that there is, behind every scientific breakthrough, there is a human story, and it continues to inspire policy changes and ethical reforms. Her story does, and the legacy lives on in both scientific discovery and also social justice, because even now, these cells are being used, which, is really important for multiple medical advancements. These are some wider reading resources that you could use to learn more about Henrietta Lacks. And yeah, that is all that I have for Henrietta Lacks case study. Now, can I hand over to Ahmed to do the pancreatic surgery, please?
Hi, I'm Ahmed, and I'll be going through pancreatic surgery with you guys today. So, what is pancreatic surgery? Pancreatic surgery is the partial or complete removal of the pancreas in order to treat a disease. So, there's four common types. One is Whipple procedure, which I'll be going over with you later. So, in Whipple procedure, the head of the pancreas and nearby structures, so maybe the bile duct, could be removed and stitched together later on to allow regular function again. So then there's the distal pancreatictomy. Sorry, I keep mispronouncing that. So that's the removal of the tail or body. It could be either, and it depends on uh, why you're removing it, maybe cancer. And then there's the total pancreatomy. So that is the entire removal of the pancreas. And then there's drainage and bypass procedures for chronic pancreatitis, which is chronic inflammation. So inflammation over a long period of time. So why is pancreatic surgery needed? So there could be obstructions of the bile duct or intestine. The bile duct and intestine are both necessary for digestion. So it is mandatory, not mandatory, but it is necessary to have them uncovered again. The pancreatic cancer, which can be localized. So the surgical procedures like the Whipple procedure are often performed to remove tumors that have not spread further than the pancreas. And there's also pancreatic cysts, which are fluid-filled sacs developed in the pancreas, and they can have the potential to become cancerous. So it's pretty important to have them removed. There's also chronic pancreatitis, which, like I said before, is the long-lasting inflammation of the pancreas, which can lead to severe pain and some other complications. So instead of just surgery, first there's other conservative treatments that can be taking place, maybe painkillers or other things, which are done, and then surgery is taken afterwards if none of those procedures work. And then there's pancreatic neuroendocrine tumors. So neuroendocrine refers to the relationship between the endocrine system, which is a part of homeostasis, and the um, hormone system. And neuro refers to its relation to the nervous system, so with a connection between the hormones and the nervous system. So this tumor develops in hormone secreting cells, so endocrine secreting cells in the pancreas, and may require surgery to remove depending on their size and behavior. Behavior could mean that they're growing, or they might be decreasing in size. They could be malignant or benign. So surgical steps of the Whipple procedure. So first of all, there's anesthesia like most surgeries. Then your body will be cut open to give the surgeon access to the abdomen. Then exploration to check for cancer spread. So this is specifically for cancer. So the area around the pancreas is checked to see if the cancer growth has occurred like anywhere else outside of just the pancreas, because that might need a different procedure. Then mobilization of the pancreas and duodenum. That means that they're supposed to be stationary in their regular functions, but mobilization means that you have moved them in a way that you can move them around during surgery, maybe rotating them or move them in a way that's easier to carry out the procedure. Then you remove the affected parts of cancer and you reconstruct connections, so with the pancreas, the bile duct, and the stomach to intestines. And then you place drains, which were used to remove blood and other fluids during the surgery from the point of incision, and then close the incision. So what are the common tools that are used during the procedure? So, like I just said, drains, and then there's also staplers to close wounds. There's scalpels, scissors, forceps, retractors, electric cautery for cutting and stopping bleeding. So cautery is when you use heat to burn cells to stop bleeding. So they're like almost like tasers in a way, but use electricity to burn cells and block bleeding. That might be used in an emergency if there's too much bleeding. Then there's vascular clamps and sutures. So clamps prevent further blood flow through a vein or artery. And then sutures are also used to stitch up arteries, veins, and any other parts that have been used in surgery. And laparoscopic or robotic instruments for minimally invasive surgery. So laparoscopic refers to tools which are thin and have lights attached to them and a camera, and they're used in minimally invasive surgery. They're quite a recent invention, and they're pretty important, along with robotic instruments, which are being used in surgery a lot more nowadays than they were very previously. So, how has pancreatic surgery evolved? So, 1882 is one of Dr. Trendelberg performed one of the first recorded human pancreatic resections. So, that's the complete or partial removal of the pancreas. Then, in 1909, Dr. Walter Koch completed the first successful partial pancreatic duodenectomy, removing part of the head of the pancreas and the duodenum. Then Dr. Alan Whipple, who the Whipple surgery is named after, performed the first modern two-stage, so there was two parts to it, pancreatic duodenectomy, aka the Whipple procedure, and that's what's left to the procedure I just explained. So 1950s to 1970s, there was a lot of advancements in robotics, not robotics, sorry, anesthesia, antibiotics, and blood transfusions, which improved the survival rates of pancreatic surgeries because previously the mortality rates were extremely high, so it wasn't done much. But because of the increased survival rates, it became a routine procedure in hospitals. And then present day, so laparoscopic and robotic techniques, which I've just explained before, allow minimally invasive procedures. So that meant mortality rates for Whipple operations went down a lot. So they've been utilized a lot more since the 1970s. So a case study, Ross Wise. So Ross Wise was 74-year-old with pancreatic cancer who underwent minimally invasive Whipple surgery, so using robotic technology, which removed part of his pancreas, his small intestine, bile duct, and gallbladder. And he recovered within 11 days, followed by chemotherapy. And then the outcome of his treatment was that after a full year, he was cancer-free completely. So that's it from me. If you have any questions, let me know. I can answer them in the chat.
Thank you. Can I please have Silver to do the interview prep, please?
Okay, so I'm going to be doing interview prep for today. Okay, so right now I'm just going to go through a basic overview of the two types of interviews you could really have. So you have MMI, which stands for multiple mini interviews. Most medical schools tend to use this form of interview. So it consists of around 5 to 10 stations and they can last between 3 to 10 minutes. Often there are 2 minutes to prepare and actually read in between the stations. I remember at one of my interviews, they actually made us stand outside and read and stand there for 2 minutes just reading and going through it. So a lot of interviews do tend to do this. Stations can actually vary in terms of what the questions are about. They usually have like one specific topic about them, for example, work experience, personal attributes, qualities of a doctor, why medicine, why this uni, etc. You can have some role play stations, some data interpretation stations, some ethical scenarios to practical tasks. So each station is a bit different, and each station will have a different interviewer. So if you didn't feel like one went very well, you can move on to like the next one with a clean slate. Like each of them are marked individually by one person, and then when you go to the next one, it's someone new. While in terms of panel interviews, these are similar to MMIs, but the questions are asked in a continuous stream. So you're not getting up and moving around as much. You're literally sitting down there having a conversation with the same two interviewers for the whole thing. So instead of rotating around different interviewers, you stay with the same ones. And it doesn't really include your typical MMI station types. For example, you're not going to really have as much role plays or practical tasks, but they can still ask things such as data interpretation or thoughts and ethical questions. Oxford is obviously a big exception where they do tend to still ask mainly scientific and medical ones and also data interpretation, but you won't get asked as many personal questions. So the main thing today we're going to talk about is role plays, just because that does tend to be one that a lot of people do struggle with. So in terms of role plays, it's mainly this is how we're gonna like approach role plays. So it's mainly having a small talk to get comfortable and setting the scene to establish what the actor already knows. Obviously, that would depend on what the role play is, but you definitely want to make sure that you are setting the scene. You want to come in quite like energetic, but also acknowledging what the situation is. Is this a situation where you're meant to be happy, where you need to be a bit sad? You need to acknowledge that and take that into consideration. You also need to make sure you have a quiet and private area, and maybe if it's a Breaking Bad news station, tissues. You don't obviously have to have any of these things, but in terms of it's going to be like a big call. It might not be quiet, but you can set the scene to make it seem as if it's quiet. Asking them, "Oh, do you want to go to a different area, more quiet area?" And that can be really good in terms of interviews. Actually having a warning shot. So this is saying, for example, I have something to tell you, or this might be a bit difficult to hear, and then delivering the news, just to make sure that they do understand that what you're going to tell them isn't going to be good news if it's a Breaking Bad news situation. And then obviously again, if it's Breaking Bad news, pausing to see what the actor's saying and if they're ready to hear more. Then responding with empathy and offering any help that you can. So looking for solutions and also asking them if they have any questions for you. Do you need any support? Do you want me to stay with you? Asking them stuff like that. So we're basically just going to go through some questions. People can answer if they want to, and if not, we'll just go through the questions. So this is one example of what a role play scenario could be like. So in this scenario, you or yourself and the actor is going to play the role of your friend Morgan. For the last week, you've been asked to look after Morgan's cat. During one of your visits, you're going to see the cat knock over an ornament that you know is very important to your friend as it belongs to their grandmother. Um, as it belongs to their grandmother, and you know it's nearly impossible to replace as is an antique. You're now meeting Morgan, who's back from holiday, and you must tell him what happened. I'm just gonna go through how you can approach this question rather than ask anyone to answer it and be another day. But ways you can start approaching this question is obviously understanding the key implications. One thing you can do in interviews is actually ask the interviewer, "Can I have a couple of seconds to think before starting the interview?" That's what your 2 minutes usually at the beginning is for, so you can use those 2 minutes to just think. Most of the time, the interview is not going to start until you start it, so you can actually usually just have a 10 seconds, then you start by saying, "Oh, hi Morgan, nice to see you back from your holiday." Obviously, you want to set the scene. As much as you want to talk to Morgan about setting the scene as in saying, "Oh, hi Morgan, how's your holiday?" You need to cut it off because your main thing is to make sure you get the point across that the ornament has been broken and that it's their cat that did it, etc. One of the things is that you want to take responsibility. Even though the cat is the one that broke it, you're the one that was meant to look after the cat. So if the cat's now knocked over the ornament, technically it is your fault. So you need to make sure you are kind of explaining like, "Oh, I know this is what happened. This is what happened. I'm the one that did this because I was watching the cat. It was a complete accident." Kind of like just apologizing and seeing what they have to say. Make sure you take a nice break when you're telling them what happened just to see how they process it. Obviously, this is very something that's important to them. Make sure when you get a big scenario like that, you actually use the information they've given you. Emphasize that you know how important it was because it belonged to their grandmother. This can be really good because a lot of time can actually help you remember what the scenario is about. When you tend to talk a lot, you kind of forget what the scenario involves. So you can start talking about other things that are not related to the scenario. But if you bring it back, you're going to know, "Oh, this is the reason why it's important. This is the reason this has happened." And also, obviously, looking at key information, like it's nearly impossible to replace, but you can talk about, oh, maybe I can look and see if we can find a replacement. I know it's nearly impossible to replace, but is there anything else I can do for you? I'm so sorry this has happened. Do you need any support? Do you want me to just sit here and you talk about it? I know that there's barely anything I can do to replace this, but I can try and repay you, even though I know that it will never reach that sentimental value that it does hold in your heart, etc. So you're talking about things like this and just explaining to them and seeing how it goes. Most of the time the interviewer is going to like bounce off what you say so they can continue it going, keep it going. It's okay to actually stop talking once the time, even before the time's ended, because it is a role play. Sometimes there's just nothing else you can do in the situation, but kind of acknowledging that and still making sure that you are approaching it in that way can be really good. But yeah, next question. Okay, so this is another type of question you can have. This would be in a more professional setting. Obviously, the last one was a cat. I remember the first cat one I got, it was that the cat got ran over by a car and I started laughing. Um, so basically, if you do more role plays, you're gonna not laugh when things like that happen. But anyway, question 2 is more in a professional setting. So you're a doctor talking to a professional hockey player. You have looked at their X-rays and it's clear that they have just broken their ankle. They will require months to recover. They will not be able to compete in the Olympics in 2 weeks' time. Um, I'm just wondering if anyone has like any ideas of things they'd like to talk about though. So I'll just give it a minute and see if anyone puts anything in chat that they think they could bring up in this scenario as a role play, like things to consider. But yeah. Okay, so one person has something to say, which is fine. So talk about what could be done to accelerate the healing process. These are definitely things that you could talk about, looking at alternatives that could happen. Um, I think one big thing to remember in this scenario is that it's basically very probable that they're not competing in the Olympics in 2 weeks' time. So actually emphasize that, but then talk about, however, maybe you can get you ready for the Summer Olympics, the next Olympics coming up, which is a really nice thing to talk about as well. Maybe something to help them calm down or give them space. I definitely think those could be really good. Yeah, definitely talking about what Janita said in terms of explaining how it's necessary to let the ankle heal and talking about like the implications it could happen if this doesn't happen. But yeah, again, similar thing. You want to make sure that you're going to a quiet room. I know obviously that you'd assume, oh, we're already in a quiet place, but a lot of times in interviews they want you to say, if it's all right, can we just go to a more quiet room? Even though you're gonna move, you're gonna be in that same position, sitting down, just saying it. So setting the scene, like if it's okay, I just want to speak to you privately. Is it okay if we go to this private room to discuss this? Then sitting down with them, then literally using the information that you have. So I've taken a look at your X-ray and I've seen that you have broken your ankle. Giving them a few minutes to process. They're obviously going to have questions. They might like. I remember in one interview that some people had one of the actors actually threw a chair at people, not at people, but they threw a chair because they were like, "What are you talking about? What's just happened?" So actually giving a few moments, like someone did say, a few moments just to see what their reaction is to the news, and then going through it. So it is going to take a couple of months to require, then you can to recover. So then you can obviously talk about there are some things we can do to try and accelerate the healing process. Maybe looking for some other methods. For example, some people really do like to use acupuncture as a supporting method to their treatment. Talking about other things they can do, but emphasizing that unfortunately you won't be able to compete in the Olympics for 2 weeks' time. Then, as Juanita said, just emphasizing why they can't compete is so important that your ankle heals, or else it could have more long-term impacts, and maybe even thinking about some of them that could occur, but literally just looking at all the different possibilities that could happen. But yeah, those are some really good ways to start approaching questions like that. Just kind of looking at whatever scenarios you think can happen. And now, another type of interview role play type of scenario you could have is problem solving. So how can this be assessed? So this could be instructions such as giving this could be stuff such as giving instructions. I remember there was one station that they did for a practice run in my school, and it was, how do you solve 2 plus 2? That was the whole station. Give instructions for someone on how to solve 2 plus 2. So you'd have to spend 5 minutes just filling up how to solve 2 plus 2 and just going through so many different methods on how you can do that. So doing things like that. It can also be coming with solutions in a role play scenario. For example, like if someone's lost something, how can you help them find it? Prioritization stations, for example, you have 2 hours to do 5 different things. What are you going to prioritize to get everything done efficiently? Following instructions. Most of the time, it's actually teaching someone else how to do something. But those type of stations, ethical scenarios, improving the NHS, data interpretations, it can basically just be tested in so many different ways. So here are some strategies on how you can best do that. So taking a logical approach. For example, the prioritization stations, figuring out what do I need to do to make sure I reach the outcome that I need. Thinking out loud. A lot of the times the interviewers will try and guide you, or they'll kind of ask you, like if you finish within 1 minute, they'll ask you, oh, I heard you said this. How can you do, what did you mean by this? Can you expand, etc.? And worst case scenario, like for example, with one of the stations, the first time I ever did a 2 plus 2 stations, I said the answer is 4, and I basically stopped talking. Obviously it was a practice station, but it will but like that's obviously not going to get you a lot of marks. So what you need to do is like, you can talk about how you got to 2 plus 2. Like you can talk about, oh, when I was in year 2, they taught us 2 plus 2 is 4. Da 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 da. How I worked this out is 1 plus 1 equals 2. Da 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 da. And then just going through all of that, and then you can actually at least show how you got to the conclusion. Because the thing is, it doesn't matter whether the answer is correct or wrong. It's more about how you got to that answer. So staying calm and not rushing, and also reading the instructions/data carefully. I have one friend, they didn't read a question carefully, and the interviewer actually stopped them and told them, that's not the question, can you start again? And that was like 2 minutes left of the question. They did get an offer, but still. Okay, so problem solving broad strategies. So this is beginning with an overview of the task. Then you can go on to describe details in a logical order. For data interpretation, thinking about social, economic, environmental factors, basically not just focusing on one thing, looking at the wider environment. A lot of times in medicine, you take a biopsychosocial approach, so looking at how you do that, or even a biomedical approach, but looking at basically how you incorporate all of these things in a question and how this could impact data. And then for real life scenarios, thinking about practical and logistic solutions to problems. So you can't just say, like with that antique question, you can't just say, oh, I'd buy you another thing. Like you're very unlikely to find it again. So thinking about practical and logical solutions. For example, I'll pay you back what I can for the ornament, even though I know I'll never be able to reach the sentimental value, is a very good way of being practical and a bit logistical about solving that problem. Okay. Now, these stations aren't obviously testing your medical knowledge, they're testing communication, empathy, and logical thinking skills. So you need to spend time before role play trying to remember key phrases to show empathy and to think of ways that you can help you access their problem solving going forward, and approach a problem solving question with an overview of the task, then progress to details. Um, with these, it's really good to have a structure. I think STAR is a really good one that a lot of people like to use. So search that up. There's a bunch of different ones. ICE is another one that a lot of people like to use. Using these acronyms, I recommend you actually make your own or find one that you really like to use, because they can be really helpful in just helping you start breaking down how you want to answer these questions. But yeah, definitely keep practicing your role play stations because they can help you get better and not laugh at cats. But yeah. But anyway, general tips again: reading the scenario carefully, greeting the actor appropriately, remaining calm and empathetic throughout, showing active listening, asking the actor if there's anything you can do to help them, showing empathy. These stations are obviously going to test your medical, not testing your medical knowledge, because unfortunately, you guys don't have any medical knowledge at this point. So yeah, it's going to just see if you are going to be a good doctor in terms of being able to communicate, demonstrate empathy, and deal with unfamiliar situations. They can teach you the medical stuff, but they rarely can teach you how to be a good communicator, etc. So making sure you're showing these things. So making sure you have active listening by nodding, eye contact, repeating phrases back to the actor, and responding in agreement. Yes, shaking your head to show that you are paying attention to them and taking in what they are saying. But yeah. Okay, so I'm also doing the well-being PowerPoint as well today. So we're going to go through obesity. So, what is obesity? So, obesity is a complex chronic medical condition characterized by excessive body fat accumulation, and it can pose a lot of health risks. It's typically defined by using the body mass index, so BMI. So, BMI of 25 to 29.9 is usually considered overweight, and a BMI of 30 or higher is considered obese. So, obesity affects nearly every system in the body and it can be influenced by genetic, environmental, behavioral, and hormonal factors. So you have different classes of overweight using your BMI, as you guys can see. You can see class 1, class 2, class 3, and then you also have other categories such as android obesity fat, which is concentrated around the abdomen and it's more common in men. And then you have giant gynoid obesity fat concentrated in the hips and thighs, which is more common in women just because of how our bodies work. So, how does how does obesity affect the brain? Recent neuroimaging studies reveal that obesity is associated with structural and functional brain changes, reduced gray matter volume in the prefrontal cortex, impairs decisions making, self control, and motivation. Um, Impairs those types of decisions. Altered activity in the reward system, so the nucleus accumbens, the ventral regimental area, increases food cravings, and inflammation caused by excessive fat can cross the blood brain barrier, disrupting neurotransmitters balance, and reduced hippocampal volume linked to memory and appetite regulation. So these alterations can lead to a cycle of overeating and reduced impulse control. What causes obesity and also comparability in individuals. So MRI and PET scans demonstrate decreased dopamine receptor availability in obese individuals, which reduces reward sensitivity, stronger neuronal responses in high-calorie food images, disrupted white matter integrity impacting communication between appetite and appetite control centers. Obese adolescents often show delayed brain maturation in areas linked to cognitive control. These findings highly suggest that obesity is involved in neurobiological changes similar to addiction. So, other causes. Obesity can arise from multifactorial interactions of genetics, environment, and behavior. Other genetic factors can be mutations in the MC4R and LEP genes, which affect hunger and metabolism. Dietary habits, so high intake of processed calorie dense food, lifestyle, reduced energy expenditure from low physical activity, psychological factors, psychological factors, factors such as stress, depression, emotional eating, endocrine disorders such as hypothyroidism and Cushing syndrome, socioeconomic factors such as limited access to healthy food and healthcare. So, health effects. So, common signs and consequences of obesity include excess body fat around the abdomen, shortness of breath, fatigue, and joint pain, increased risk of type 2 diabetes, heart disease, stroke, and certain cancers, sleep apnea, and hormonal imbalance. Psychological effects can also include low self esteem, anxiety, and depression. So, diagnosis of obesity. Doctors diagnose obesity primarily using BMI, so body mass index. The numbers are there again, guys. So you can actually calculate your own body mass index by measuring your height in meters and then squaring it, then dividing your weight in kilograms by your height in meters squared to find your BMI. So additional diagnostic tools can actually include using your waist circumference to find your abdominal fat indicator, blood tests to see your glucose, cholesterol, liver function, those types of levels, and imaging for fat distribution. Mainly DEXA scans or MRIs are used, and actually looking at your medical and family history review, as obesity is commonly a family hereditary disease as well. So there's a lot of different treatments being used. So every year, an increasing amount of money is spent on treatments in obesity and diabetes. Around two-thirds of adults and 1 in 5 primary school leavers living with obesity. As a way to raise awareness of this, there has been an increase in the amount of health campaigns, with the sugar tax being introduced in 2018. The money from that has now been invested in schools for sports and breakfast clubs. For example, you have the Better Health campaign, which this campaign started as an aim for people to lose weight after it found that 8% of people in the ICU with COVID-19 were morbidly obese. The campaign measures included banning junk food ads after 9 p.m. The buy one get one free initiative ran by many brands was also scrapped. Calorie labeling became mandatory for shops with over 250 employees. An example was meant to be shared. It was McDonald's, but it got removed. The diabetes prevention program was also expanded, and the diabetes prevention program was accelerated. You also have the Exercise 2019 campaign, where exercise also became a huge initiative, with over £2.5 million being invested in training new PE teachers and getting new school facilities, as well as creating over 400 million new after-school clubs. This is an ongoing initiative in 2019 to combat obesity. Causes of obesity are also not always due to unhealthy eating styles, which is why it's important everyone is informed about the causes of obesity and how these can also be an effect of thyroid problems, which is also why we're doing this in the wellbeing program. For example, I have a friend who has hyperthyroidism, and that has led to her being quite obese and having some other health issues. So it's really important that this is talked about. However, these initiatives recognise that and are put in place to keep people healthy and maintaining a good lifestyle so they can remain in optimal health. So why 22.6% of children aged 4 to 5 were overweight in 2018 to 19, and this had a direct effect on the number of children with type 2 diabetes, as there has been a steady increase in cases over the last 5 years. So some more treatments. These are kind of the less known ones. These are the known ones, and the less known ones are underneath. But yeah, so management includes lifestyle, medical, and surgical approaches. Lifestyle changes can include a balanced diet, regular exercise, and also behavioral therapy. Medications, for example, a GLP-1 agonist, e.g., semaglutide or liraglutide. These reduce appetite and also improve glucose control. You can also have bariatric surgery, such as a gastric bypass, a sleeve gastrostomy, or a gastric binding, most effective for severe obesity. Psychological support includes CBT, so cognitive behavioral therapy for emotional eating, and also regular follow-ups, and these include monitoring health, weight, nutrition, and mental health. Some recent advancements also include gut-brain axis research, understanding how the microbes influence appetite and mood, mostly focusing on looking at leptin actually. CRISPR-based gene therapy targeting obesity-related genes, for example, MC4R, as I talked about before. The brown fat activation therapy stimulating thermogenesis to increase energy expenditure. And also new drugs, for example, trizepatide, a dual GIP and GLP-1 agonist, show significant weight loss in trials, and also neuroimaging studies which identify how the brain inflammation affects long-term weight regulation.
Thank you very much, Silver. So yeah, that's it. That's all we have for this week's seminar. I will be sending the attendance form link in just a moment. So yeah, thank you for joining the seminar, and hopefully you found it useful.